The HoverSling Repositioning Sheet is an air-assisted lateral transfer device and repositioning sling in one. This single patient-use product can stay with the patient, allowing for seamless transitions between lateral transfers and vertical lifts. The HoverSling Repositioning Sheet was designed to reduce cost and simplify patient handling by streamlining the number of devices used to transfer, lift, turn, and reposition a patient. The combined benefits of a lift, sling, and air transfer technology are met in one product that protects caregivers from injuries related to patient handling while providing a more comfortable experience for the patient. In this video, we'll explain how to safely utilize the product as a repositioning sling and as a lateral transfer mattress. The repositioning sheet has 8 lateral transfer handles, 4 located on each side, at the bottom of the sling straps closest to the HoverSling. The design of these handles ensures the caregiver always remains close to the patient for safety during inflated HoverSling use. This is called the Stay Close approach. There are 8 sling support straps, 2 located at the foot of the product, 2 on the outer side of each leg, 2 at the shoulder, and 2 at the head end. These straps are color-coded for patient positioning and to match strap placement on the left and right side when attaching to a lift hanger bar. There are 8 storage pockets. Each one is located next to a sling support strap for use when the repositioning sheet is implemented as a lateral transfer mattress. There are 2 hose entries, one on each side of the foot end of the repositioning sheet to make transfers more convenient. The hose is inserted into the opening and secured with a non-ferrous snap and Velcro closure. The labeling on the repositioning sheet indicates the head end, center line, and foot end of the device. The instructions for use, warnings, model number, and lot number are also included. The repositioning sheet has a 1,000-pound patient weight limit for both the 39-inch and 50-inch models. It is a single patient use device and should be discarded upon the patient's discharge or if heavily soiled. Do not launder the HoverSling repositioning sheet. To use the repositioning sheet as an air transfer device, the HT Air supply is required for inflation. It is also compatible with the classic model Air 200G and Air 400G air supplies. The HT Air has an LED control panel. 3 buttons initiate airflow, and a standby button turns off airflow. The standby button is the second button from the left. When the air supply is plugged into an electrical outlet, the standby button power indicator light will be lit. Press the standby button anytime you need to stop airflow. It's important to remember that although airflow is stopped, power is still supplied to the device. To the right of the standby button are the airflow options for HoverMats and HoverJacks. To supply airflow to the 39-inch and 50-inch HoverSling repositioning sheets, press the button labeled 39-inch and 50-inch HoverMat. If you are using the Air 200G or Air 400G, press the gray button to initiate airflow. Always use a minimum of 2 caregivers when using the repositioning sheet for lateral transfers. If possible, place the repositioning sheet on the bed prior to receiving the patient. If desired, place linens and protective pads on the device to keep the surface clean. For the purpose of viewing the product features, we will demonstrate without linens in this video. If the repositioning sheet is not already on the bed or stretcher, place it underneath the patient using a log rolling technique. Make sure the patient is centered on the repositioning sheet and positioned with his or her head about 2 inches down from the top edge. The head indicator shows where the top of the patient's head should be. Ensure the sling support straps are tucked into the storage pockets and the transfer handles are visible. Make sure the transfer surfaces are as close together as possible with wheels locked, and the bed heights allow the best ergonomic working height for the shortest caregiver. Transfers should be performed from a higher surface to a lower surface, approximately 1 to 3 inches difference whenever possible. One caregiver should be positioned next to the patient before the air supply is turned on. This caregiver should inform the patient of the task. The caregiver should be next to the patient with their body next to the repositioning sheet and hands on the transfer handles. This is called the position of safety. Inform the other caregiver it is safe to begin inflation. The caregiver will insert the hose into one of the 2 hose entries by opening the flap and inserting the hose at a slight angle. The hose should be snapped into place and the entry flap closed around it. Turn on the air supply by pressing the appropriate airspeed button for the repositioning sheet while the other caregiver maintains the position of safety. If using HoverTech's original air supply models, Air 200G or Air 400G, press the gray button to initiate airflow. Once air begins to flow, the repositioning sheet will inflate and begin to cradle the patient. When the repositioning sheet is fully inflated, the caregiver on the sending side should begin the transfer by pushing the repositioning sheet at an angle towards the receiving caregiver. This reduces unnecessary reaching on the part of the receiving caregiver and ensures both caregivers maintain ergonomic positioning. To ensure the patient is centered on the receiving surface, one caregiver should remain close to the patient while the other caregiver performs a visual check at the foot end of the bed or stretcher. Move the repositioning sheet to center the patient as needed. The caregiver at the patient side will then assume the position of safety and ask for the air supply to be turned off. Turn off the airflow by pressing the standby button. The caregivers can then raise the side rails and elevate the head end of the stretcher if needed. The air supply hose may be removed. If the repositioning sheet is not under the patient, place it using a log rolling technique. For vertical lifts, the repositioning sheet can be used with any loop-style hanger bar. In this video, we will show use with a 4 or 2-point hanger bar. Begin by lowering the bar and positioning it over the patient's midsection. Attach the shoulder and mid-body straps. Next, attach the feet support straps to the hanger bar. Finally, attach the head support straps to the hanger bar for the proper safety and comfort of the patient. It is important to match the strap placement on the left and right side of the repositioning sheet using the appropriate color-coded strap loop on each side to ensure the patient remains flat. If using a 2-point hanger bar, attach the 4 upper body straps to the loop closest to the patient's head. And the 4 lower body straps to the loop closest to the patient's feet. Ensure that all 8 sling support straps are attached to the lift. Lift the patient according to the lift manufacturer's instructions. With the stretcher positioned next to the patient's bed, move the patient over the stretcher, ensuring the patient's body is centered before lowering. Disconnect the support straps from the hanger bar. Adjust the repositioning sheet so it lies flat, with no straps underneath the patient. Raise the bed rails. To initiate a lateral turn with a repositioning sheet, ensure the bed rails are up. Lower the hanger bar to a comfortable working height and position it over the patient's stomach region. Attach the repositioning sheet straps on the opposite side of the patient turn to the loops on the same side of the hanger bar, starting at the foot end. Make sure all 4 straps are attached. If using a 2-point hanger bar, attach the foot and mid-body straps to the lower end of the hanger bar, and the mid-body and head straps to the upper end of the hanger bar. Press the up button to begin the lift. As the lift is raised, the patient will turn toward the side of the bed opposite the attached straps. Use wedges to keep the patient in position if desired. Then, lower the hanger bar and remove the sling straps. return the lift to the docking station. To perform a lateral turn for hygiene or wound care using the repositioning sheet, lower the hanger bar to a comfortable working height and position it over the patient's chest region. Attach the sling strap closest to the patient's shoulder to the hanger bar. If the patient is able, bend the knee or cross the leg that will be on top after the turn. Press the up button to begin the lift and turn until you can access the lower half of the patient's body. Leave the repositioning sheet in place until the task is complete. Then, lower the hanger bar and remove the sling strap. Return the lift to the docking station. Please refer to the HoverSling manual for more information.